Hello friends, welcome to Nirmal. I'm Piyush Jain, and today we are bringing to you a new company, a listed company, a company which is operating into the pharmaceutical supply chain, Supriya Life Sciences, a company with market cap more than 2,000 crores, has been really increasing its capacities over the last 2 years. Growth opportunities are looking quite visible. And to know more about the company, its trajectory, how has been the start of FY24 for them, let me now welcome the management. Dr. Saloni Wagh, Director of Supriya Life Sciences Ltd. Dr. Saloni, welcome to the show.
Hi Piyush, thank you for having me.
So, Dr. Saloni, before we go into the the traditional numbers, let's, for our viewers, for the benefit of our viewers, let's break down the business model of the company. I understand it's a company which is making APIs in a couple of categories. It is one of the largest exporters in the country. Help us understand the business model, the journey, and what's the unique aspect about the company.
So Supriya Lifescience Limited is a 34-year-old company. This was started by our chairman, Dr. Satish Wagh. He's a first-generation entrepreneur. Like you rightly said, we are a 100% pure-play API company. We have a leadership position in therapeutic categories like antihistamines, anti-allergics, anti-asthmatics, vitamins, where we have a leadership position because of the scale at which we operate and because of the backward integrated business model that we have. We are a three-time USFDA approved company. We also have approvals from Health Canada. We also have approvals from NMPA China. We are audited and approved by over 30 regulatory authorities. And that I would say is one of the key strengths of the company because we are present mainly in the regulated market. In fact, our revenue model, if you look at it, 80% of the revenue is generated through exports, only 20% in the domestic market. And out of that 80%, also over 45% is coming in from the regulated markets. So basically, a lot of focus on getting the right regulatory approvals, having large capacities so we can have that leadership position, and fully backward integrated business model are some of the key strengths, I would say, of Supriya Life Science Limited.
When you say backward integration, for example, I know you are quite big in chlorpheniramine, malate, ketamine hydrochloride, salbutamol, sulfate. Couple of these names, perhaps for our viewers, would be technical in nature. So, two follow-up questions for me. In terms of these APIs, what primarily the sort of medicines or primarily the end use of these APIs are? And secondly, when you say backward integration, it usually gives a moat here. So, when you say backward integration, what kind of backward integration you've already achieved?
So, in terms of the APIs and the therapeutic categories, our key strength is antihistamines. So, your first line of treatment whenever you have cold, cough, fever, and you would like to buy any kind of medicine which you get over the counter in any of the chemist shop, you will see chlorpheniramine maleate is a part of that formulation. So, it's the first line of treatment for cold, cough, fever. So it is one of the most widely used drugs across the globe. It's an old product, but year on year it has shown growth and it is repurposed with different drugs and it keeps on coming in with new combinations. So these are the main areas where our product portfolio is. Then
And if
vitamins, as you
I
know,
remember, it would also go in the cough syrups and
cough
uh,
syrups, yes,
yeah.
absolutely.
Okay,
So any
sure.
first line of treatment that you take, may it be your tablets, cough syrups, that will have these products, especially from the antihistamine and the anti-allergic category. And then vitamins is also another area, as you know, that most of the people are very health conscious now, and they believe in preventive, medicine rather than taking it afterwards. So multivitamin tablets are a big part of our lifestyle now. So we also produce some vitamin products like vitamin B2, B12, which goes in nutrition supplements. Then we have anti-asthmatic category, basically, which goes into your inhalers, what you get in the market for asthma treatment. So these are just some of the key therapies in which we operate. Anesthetic, which is pain management, is also a very large part of our portfolio. So basically, all the sedation drugs are there in our portfolio. So these are just some of the therapeutic categories. In terms of backward integration, I would say that we were one of the very first companies in India to understand the importance of backward integration. We are backward integrated to KSM level. So basically, all the products that we manufacture, we only buy the starting raw material, which is a basic chemical, which is available across all industries, and it is freely available. It is also available in India, so we don't have any country
I'm saying
dependence.
the basic raw material is almost like a general commodity, as you're
General
saying.
commodity drugs, absolutely. So we buy only those chemicals from outside, and then the entire process we are doing in-house. So for certain products, up to 8, 9 stages we are doing in-house. For our key products, the top 13 products which contribute to almost 80% of our revenue, we are fully backward integrated.
Well, that's quite a simple explanation, and also again, we are now able to understand in terms of integration. Now, let's go into the June quarter numbers. June quarter numbers are looking quite healthy. There is a 30% growth in the revenue, 40% growth in the EBITDA versus the last year. I want to link it in a way where, and in one part, June quarter is looking quite robust, but we also saw that there was a particular impact in the last year, the full year numbers. Uh, what was it? Was it related to some geographical China impact? And has something been changed in June quarter? Help us understand the numbers from that aspect.
So basically, like I mentioned, our business model is export, and it is spread across different geographies. Today, also, we are present in more than 86 countries. So, in certain quarters, it is possible, depending on the product mix and the region mix, the margin profile would be significantly higher. However, we have always maintained that on an annualized basis, 28 to 30% is something which we are very confident that we can maintain. Although there is a very large scope for us to go above that 30% mark, but that is something 28 to 30% is something we are very confident we'll be able to maintain long term. Like in this quarter, our majority sales have happened in Europe. That is one of the reasons why the margins have been significantly better. If you look at the total revenue contribution, 35% is coming from Europe, 10% our North American sales have gone up significantly up. So 10% is from North American markets, 10% is from the Latin American markets, which is again a regulated market. So around 55% of the total revenue for this quarter has come in from these markets, where the average selling price is far better than what you get in semi-regulated markets. And that's one of the reasons why you see a turnaround in margins. But we are very confident because we have worked really hard on de-risking our portfolio post our last year's challenges. We are very confident that going forward also margin profile would be similar to what we have seen in this quarter.
Well, that's heartening to know. I also wanted to ask you on the working capital. We have of late seen, and I was just, please correct me if I'm wrong. I was just looking at the working capital trend in FY22, FY23, and I was interested to know about the FY24 early trend because we saw basically a bit of increase in the working capital requirement, overall working capital intensity of the business. What was the reason, and how FY24 is looking to you?
So, in terms of working capital, yes, it has gone up slightly, but that I would say is a conscious call on the company's part because we are looking at a revenue which is 500 crore plus. So, you need to, and the times are very uncertain. There is a lot of instability in import from various countries. So, as a conscious call, our inventory levels are slightly high, but they are meant to be on those range because we want to cater the existing business what we see on hand. So that's
But
the only reason why.
is it is largely because you were importing raw materials in advance just to protect yourself against any supply chain shock? Like, what was the reason of inventory buildup?
So that's the precise reason why, because there is so much of instability, like I said, during imports and all. And if there is any delay, then we cannot delay our, commitments to our
Delivery.
customers. And
Yes.
because some of the raw materials that we operate for key products are imported, we just want to ensure that we have good coverage of raw materials so that there is no supply chain disruption.
Fair enough. Let's go to the exciting part here. Help us understand your order pipeline, your contract manufacturing opportunities. How's the FY24 looking to you broadly?
I think we are at a very exciting phase. There is a lot of growth which we see in the next 2, 3 years. And we have always said that, that we would like to double our top line in the next 2, 3 years. In terms of new products, we are infusing a lot of new products in the basket, mainly to de-risk the portfolio. And any dependence on any particular geography or product, we would like to de-risk. We are adding a lot of new products in anti-anxiety category, anti-diabetic category. These are some of the key focus areas for the company. Plus the existing therapies like antihistamines. We are broadening the basket by adding second generation molecules there. And we are already seeing some good traction on the new products with the existing customer base. As far as CMO opportunities are concerned, that's one area where we envisage a large growth coming in the next couple of years. We have two very large opportunities which we have recently announced. One is with a very big European company for a 10-year exclusive API supply. So there is a lot of stability which will come from this contract, and this is one of our existing products, so we would get a larger market share also. And then there is another one which we recently announced with a US-based company, Plasma Nutrition. This would be our entry into a very new space of protein, which, as you know, that it is a very large growing area in India and across the globe. So a lot of potential we see in these two CMO opportunities. Both are exclusive and both are long-term contracts. And there are a few other CDMO opportunities also which we are discussing. We anticipate that in the next 3 years, CDMO would be a large contributor to the company's growth. At least around 15-20% of the top line would be generated from these CDMO opportunities.
Right. A quick sort of calculation of the numbers here. From these two visible large opportunities, what is sort of annualized revenue you are estimating?
So that is something which we can't share at this point because we are bound by
Okay.
confidentiality. So we'll not be able to talk in terms of revenue, but
Sure.
definitely the contribution would be significant in the next few years.
Right. Apart from these two, any particular visibility in terms of order pipeline from contract manufacturing, like as what it looks like in June, July for this year?
Yes, there are two opportunities which are again at a very advanced stage, and hopefully in the next 2 quarters we should be able to make another announcement of a large tie-up.
Okay. And also one more thing, I was going through the data, the numbers, and it appeared to me that the capacity utilization is around 70%. Please correct me if I'm wrong. The data graph was telling me like that. Is there anything sort of capex which you have to do again next year, or right now for this year and next year, largely revenue growth is going to take care of the capacity?
So, in terms of capacity utilization, you're right, it is at around 70%. We have to understand that this is a multi product facility where we are manufacturing 30 plus products. So, the maximum or the optimum capacity utilization will be somewhere around 75 to 78%. It can't be higher than that because the product mix is as such. We are actually expanding our capacity already. We have taken in a new production block, which is our module E. It is under construction and it is expected to go into operation somewhere end of this financial year. This would add another 300 KL to our capacity. So probably towards end of next year, end of this financial year, we would be at around 1000 KL capacity. This is needed because there are a lot of products in our current basket where we are doing the regulatory registrations, and once we get those we can see a good volume uptake for the existing basket plus the new products what we are adding into the portfolio and the CDMO opportunities. We will need additional capacity. That's why the module E is underway. So we are
Doctor,
doing around 60-70 crores of capex on the module E.
sure. So I have two follow-up questions quick here. Is what's the normal asset turn on your capex? Because I would assume this capex is a brownfield capex, so perhaps the asset turn is going to be slightly higher. So an asset turn of 4 to 5 times, is that something which you normally operate at, or it's a different number?
So initially, I would say asset turnover of around three because it takes a certain amount of time for the product to get into the regulated market space. So and pharma, especially the regulatory approval procedure is pretty long. But yes, once the optimal capacity is reached, four is something that we can achieve. But currently, I would say three would be a conservative number.
Okay. And if my sort of numbers are like looking right, your capacity is expanding by around 40%. Was that the right number I was hearing when you were giving absolute numbers?
Yes, almost I would say 40 to 45% increase in the capacity. We also have another facility coming up in Ambernath, which would also go on stream end of this financial year. So if I put together the Ambernath capacity also, in fact, it would be doubling the capacity. So today we are at 540 KL, and once Ambernath and the Module E comes in place, it would be around 1000 KL. So I would say almost doubling the capacity.
Material capex, and that implies basically both the capacities would be commissioning in March, another quarter of very careful sort of ramp up, but next year perhaps we are going to see the sort of full impact of commissioning of these two capacities. Would that be a fair assessment?
Absolutely. I think next financial year is where we can see a larger jump, because both of these, in fact, production blocks would be in operation and would be at optimal utilization also. So I think next year we could see the bigger jump.
Well, this sounds the music, I think, for our viewers. So I think our viewers would be keeping a close eye on the expansion, the commissioning, and perhaps next year should be bringing a lot of more revenue opportunities. Nevertheless, as you just highlighted, this year perhaps order pipeline is looking great, and that perhaps is going to feed into the way of new capacities. So overall, it's looking promising. Dr. Saloni, we truly recognize there's a lack of time. You perhaps have to go somewhere, so I think we'll leave you for now here, and we're very grateful for you to come on the show and really enlighten our viewers about the company, the progress, and how basically FY24 is looking like.
Thank you so much. Thank you so much, Piyush, for having me. It was my pleasure. Thank you.
And dear viewers, hope you enjoyed the show. And for now, it's a wrap.
Subscribe to our YouTube channel and click on the bell icon to never miss an update from Nirmal Wagh.